Welcome, everyone. Today we'll be discussing the important aspects of our return to sport protocol for our 19-year-old elite European handball athlete who's recovering from surgery post slap lesion repair. I've chosen 4 tests to run through to guide our return to sport for the upcoming national competition. These include the glenohumeral internal rotation deficit test, or the GERD test, the athletic shoulder test, or the ASH test, rotator cuff strengthening, or strength, and return to full velocity throwing. So the first test in our return to sport battery is the glenohumeral internal rotation deficit, or GERD. GERD is a key factor in determining shoulder health and readiness to return to sport, particularly in athletes who rely heavily on overhead movements, like our handball player. In our assessment, we measure the difference in range of motion between the athlete's dominant and non-dominant arms, or the injured and non-injured arm, and we use a specific criteria, and we ensure that total range of motion difference is less than 10 degrees between the two sides. Internal rotation difference, also known as GERD, which we're specifically measuring, is less than 7.5 degrees. External rotation difference is less than 10 degrees, and a combined internal and external rotation of less than 2.7 degrees. A deficit of more than the above would increase shoulder injury risk, and it has been shown to increase shoulder injury risk in pitchers. To conduct this assessment, we need a bubble goniometer, a mat, markers or tape, and a camera for recording. The athlete lies supine on a mat with the arm to be tested abducted to 90 degrees, as shown in the pictures. We stabilize the scapula and measure both internal and external rotation using the goniometer. These measurements are then compared to the non-dominant shoulder. For our athletes to return to sport, they must perform these tests without pain, and this is crucial because pain-free movement ensures no underlying issues and minimizes rotation deficits and reduces the risk of re-injury. Objective measurements provided by the GERD assessment offer reliable data with a high reproducibility rate, and it allows us to make an informed decision. Although this test does provide reliable quantitative data, it can be time-consuming and it's limited due to its non-functional clinical nature, which doesn't mimic throwing. Therefore, it can't be used in isolation. The second test, or another very important test, is rotator cuff strength. Now, the key criteria for this strength assessment includes pain-free max strength tests, the external rotation to internal rotation strength ratio in the dominant arm and at 90 degrees abduction, which should be greater than 0.75. So our criteria will be that mark. On top of this ratio, we've got the actual strength of the shoulder. If it is the dominant arm, it should be 110% of the uninjured shoulder. While the non-dominant arm, there is room for a little bit of weakness. So 90% of the uninjured arm is the desired strength result. It's also essential that the external rotation strength is at least 1.8 newtons per kilogram, and the internal rotation strength is 2.2 newtons per kilogram. Now, imbalances in strength and reduced strength below the measures have shown to reduce the likelihood of re-injury. For this assessment, we use the mat assessment pullet system to measure isometric strength. The athlete will lie on a comfortable surface and will use markers or tape to ensure consistent positioning. A camera or smartphone will be used to record the test. And for the strength assessment, the athlete will will lie down, as shown in the pictures, with their arm out at 90 degrees and the elbow flexed to 90 degrees. We'll use the mat assessment pullet system in both directions as displayed on the screen. And the athlete will pull into external and or internal rotation with maximal effort for 3 seconds, and we'll record the force exerted for both external and internal rotation, and this will be performed 3 times in each movement with a 20-second rest between trials, and the external to internal rotation strength ratio will be calculated for each shoulder. Now, this provides us, again, with another objective measure that's reproducible and gives us a good indication of shoulder dynamic control capacity. It is limited to it being, again, another clinical test, and the shoulder not being used in isolation, not being used in isolation in the sport. So, and it requires a certain level of manual skill to reproduce these tests. Now, further to rotator cuff strengthening, we will utilize the athletic shoulder test, or the ASH test. This test evaluates overall shoulder strength and health and can contribute to understanding a player's readiness for return to sport. The equipment required includes a handheld dynamometer, and that handheld dynamometer must measure time to peak force. A camera to record the test can be useful, and a mat for the athlete's comfort. Now, we place the markers on the floor to indicate 135 degrees, 90 degrees, and 180 degrees Those are the three positions the test can be done in. The athlete lies prone on the mat with their forehead resting on the 4 centimeter foam block or on their arm by the side, as long as we reproduce it the same each time, and their hand placed on the vertical axis platform. Now, both upper extremities are tested to ensure accurate data between dominant and non-dominant limbs. As we said, the test can be done in many positions, but specific to our European handball athlete, we'll be interested in the overhead movement. So up at that 135 degrees or even 90 degrees out to the side. The athlete pushes the shoulder down into the device with their elbow extended for 3 seconds in each position, and we'll record the force exerted with the dynamometer. 3 trials are performed for each position with a 20-second rest between trials and a 5-second rest between exertions. Criteria to inform our return to sport: the athlete must perform the test without pain, achieve a peak force within 20% of the normal value for their sport and position, and force output should be symmetrical between the dominant and non-dominant arm with no more than 10% difference. These criteria ensure the shoulder strength and readiness to handle sport-specific demands, which reduces the risk of compensatory injuries due to imbalances and ensures the athlete has the capacity to react with speed and produce force on a demand within the sports context. Now, the ASH test provides real objective specific measurements, which are great. They're relevant to the overhead sport and easy to use with minimal equipment. However, variability in force measurements and technique can affect results, and the equipment can be expensive, especially the ones that measure time to peak force with some force plates. It also offers a limited functional assessment. Although it's in a desired position, it does not fully mimic the dynamic sport-specific movements required in the sport. Now, finally, my favorite test is for return to sport is returning to full speed throwing or high velocity throwing. Now, this evaluation serves as a pivotal determinant for our athletes' safe return to the game. The equipment we require: a radar gun to measure throwing speed, pain assessment tools like the visual analog scale, video recording equipment that can help us analyze their biomechanics, especially as they fatigue, as you do more, and obviously an open area of throwing. Now, the athlete begins with a thorough warm-up, including dynamic stretching and a gradual build-up of throwing intensity, with technique as displayed in the demonstrations on the screen or in the pictures on the screen. We measure and record the throwing speed using a radar gun and assess pain after each throw using a visual analog scale. Now, starting at lower speeds, we gradually increase, reaching the athlete's normative speed or the speed comfortable before the injury. So we should have some data if we do some pre-screening in our preseason, and we want to try and get as close to that speed as possible. Now, we record the number of pain-free throws at each speed increment and perform video analysis for biomechanical assessments. Now, we consider the absence of pain during throws at normative speeds as paramount for return to sport. Additionally, the force generated should be within 10% of the athlete's peak performance before the injury. Proper biomechanics without compensation is crucial. In particular, we like to look at the sequence of movement, moving into rotation, making sure there's an adequate sequence of movements throughout the lower body and up through the trunk and then into the shoulder, along with consistent performance without signs of fatigue or decreased form over multiple sessions. Now, elite handball players in the central part of the court had the greatest number of throws and the highest speeds of 23.93 meters per second. However, throws that led to potentially a goal had speeds of up to 24.04 meters per second. So really, we want to be up at that 20 to 22 meters per second before we can say, okay, our athlete's ready to return to sport. Now, pain serves as a clear indicator of injury or incomplete recovery, while peak force near normal levels indicates recovery of strength and power. Proper biomechanics reduces the risk of re-injury, and consistent performance ensures sustained readiness for activity, reducing the risk of re-injury. Now, the absence of pain offers direct insight into recovery, but may vary subjectively. Peak force provides an objective measure of strength and power, but requires equipment and may be influenced by factors like fatigue. Biomechanical analysis allows us to proper analyze the technique, and this consistency ensures readiness for sustained activity, but is time-consuming and may require multiple sessions. We can't just go off one. By meticulously assessing these factors, we ensure our athletes safe and confident to return to the game. Some other factors that we must consider that have been identified in studies as risk factors are fatigue, previous injuries, psychological readiness. We may do that through some questionnaires, as these can all influence recovery and performance. Some other key factors modifying return to sport include health factors such as general health, flexibility, and strength of the whole kinetic chain. And then we want to look at everything, the athlete from a holistic point of view. Thank you very much.